Well, hi, everybody. It's another Conversations With, and I have some great guests today, and they're from the Urgent Care Center in Charlton. Am I right?
Well, Charlton Family Practice. It's
Yep.
adjacent.
Same thing.
Yes,
Same,
exactly.
yep.
Right.
Great. And you are?
I'm Alan Blosser. I'm a physician assistant in internal medicine.
Internal medicine. Terrific.
I'm Jennifer Jenkins, and I'm his assistant.
Wonderful. Well, one of the things they're here for today is it's the thing I talk about every year at this time of the year. In fact, it's even a little late for me. Normally I start in August, but it's flu shots. And the thing that I want to chat with these folks about with Jennifer and Alan is the thing that baffles me is 50% of the people in this country do not get a flu shot. And we can't, they're everywhere. Every company, every insurance company will cover them. It's just, all you gotta do is go get one. And people, just for whatever reason, I can't believe that 50% of the people don't get them. And it just baffles me. And I mean, I can't wait to get mine because I just know that it's one little thing I can do to protect myself from now until next April so that I won't end up where I don't want to be.
Right.
Okay, and it's that simple. And I know, Jennifer, earlier we were talking about some of the myths and some of the reasons that people don't get a flu shot.
Correct.
Share some of those with us.
The funniest one that we have is that they're worried the government is putting a tracking device in them, and that's my favorite. Some say that.
But how do they think that that's a tracking device?
I think they're just theories that people hear over time, and they, sort of stick in their head.
Well, if they got a Social Security number, the government's already doing that.
Exactly.
Right.
Exactly.
They already got them.
Yep. You got it.
They don't need you now.
Right. Right. The other one, as you were saying, is that some people think they're going to get the flu. You can't get the flu from the flu shot.
No, you can't.
Right.
No.
Right.
That's it. But I mean, and then there's a lot of other reasons, and most of which are just excuses. I know when I was a little kid growing up, we had a lilac bush in the yard. My father used to get a new car every 2 years. He'd get home from work about 10 after 5. And the lilac bush was right near the garage. So one morning at breakfast, he says, "Son, last time I came home, the lilac bush brushed against my new car. If you get a chance, will you trim that back?" "Sure, Dad, I'll do it." Well, on the way home from school that day, a bunch of us got together and we went and played ball. And the guys were going, and I said, "Oh, great chance, I'll play. I'm in." And by the time I got home, it was about 2 minutes to 5, and he came in at 10 after 5. Went through the whole supper, never said a word to me. When we finished, he said, "I want to talk to you." I said, "Yeah." He says, "You and I talked this morning, and told me you were going to trim that bush." And I came home today thinking it was all done, and I, lo and behold, drove in, and the lilacs brushed against my car again. "Oh, Dad," and I told him about this great baseball game, Alan, that we had played that day.
Right.
And he let me finish nicely, and he says, "Look, there may be 10 reasons why you don't do something, but there's not one excuse."
That's right.
All right? And it's the same, it goes back to that.
Yes.
There may be 10 reasons why you don't get one, but stop making excuses. I'm afraid of needles. So what? Take it anyway. Tell them to drill, they might hit oil. Who knows,
It's true.
But Alan, let's talk about it. Let's talk about the reasons why people, and especially elderly folks, I know that's a group of folks that really need to get them.
Right. Right. Absolutely. It's important for everyone, basically. If you're over 6 months of age, you really should be getting a flu shot unless there's a contraindication, which really are far and few between. But to your point, there are certain populations, those with advanced years, that it's especially critical for. It's been shown through various studies. One study, I believe, showed a 57% decrease in hospitalizations for flu-related issues for those over 50 versus those patients that didn't get flu shots. So it's very significant numbers, and if it can prevent a hospitalization and a potential, unfortunately, deaths occur from the flu, it's such a small measure of prevention.
Let's stop on that a second.
Okay.
Because if you look at it from that perspective,
right?
Because there are deaths, unfortunately, from severe cases of the flu, and so in a funny way, what you're doing is you might be saving your own life.
Right. Absolutely. It's not an inconvenience.
You might
right.
just be saving your own life.
Right.
And then the second thing is hospitalizations. I mean, you go to the hospital and you're in there and with the flu, it's usually, you're not there for overnight.
Yeah.
It's 4, 5, 6 days.
Right.
And just the expense of that. And depending on your insurance, most people have some active costs on their own.
Right.
Either they got a deductible that they got to cover or whatever. So no matter how you slice it, insurance is wonderful, but ultimately, first of all, you're paying for the premium.
Right.
And secondly, you're going to pay some sort of a cost in all of this. So you're running the risk of and not only that, but the more times people use their insurance, I just got my information for 2018. My Medicare and I buy an add-on. I have a United Health add-on policy to give me extra protection. They all went up.
Right.
$10 a month.
Right.
So, and the reason it's going up is because of the number of people using it. It's all the cost basis. I mean, insurance is easy, folks. Let me give you an example. If the insurance companies knew that everybody in America would break their right arm next week, they would have an exclusion for right arms.
Right.
How they base that is on the number of people who don't need it, but have it. And so, to that point, you know, plus the fact you're in the hospital for a week.
Right.
You know, and if you got a job, your boss ain't going to be very, very pleased. But again, it goes back to wanting to protect yourself and take care of yourself.
Right. Absolutely. I think a lot of people view the flu as a mere inconvenience, but it can set a chain of events off where it can start off as the flu, and next thing you know, you're in kidney failure, you have pneumonia, and that's how some very bad outcomes can happen from something that sounds as innocent as the flu.
No question, the flu weakens your system.
Right.
Yes.
Absolutely.
You know, and there are some real severe cases. I mean, you know, but again, the amazing thing is, and I'm blessed to the degree that I get my flu shot, and fortunately I've gone through, and we've had some tough winters here.
Right.
I go through that winter and I have asthma on top of it, and so I have to really be careful because if I get a cold, I can have bronchitis like that.
Right.
You know,
Right.
so I have to really watch it, and so it's vital that I get my flu shot, and I have a physician, and I see him every 6 months, and you know, I met with him in July, and the last thing he said when I was leaving, he said, "And don't forget to get that flu shot," you know, and I said, "Don't you worry," you know, and it's important that people understand that it could save your life.
Right.
Right. Absolutely.
You know, it could save your life.
And who wants to feel like junk for an entire week? I wouldn't want to.
Oh, and boy, I'll tell you, someone who gets the flu, it is a miserable, miserable existence.
It is.
Right.
I mean, you can hardly get out of bed.
Right.
You know, I mean, it just knocks you for a loop.
Yeah.
You know, and to your point, you're in bed for a week and
Right.
8 days, 9 days, and then if you got kids and you got a family, guess what you just did?
Yep.
You brought it home.
Everybody's got it.
Yep.
They'll line them right up.
Yep.
You know, and you get well, and then your husband's down, and then he gets well, and Junior's down,
Right.
and then Mary's sick.
Right.
You know, and boom, boom. I know when I had my radio stations, that I used to have big staffs. I used to tell anybody who got a cold was not allowed to come to work, because especially in the studios, I mean, we were on the air 24 hours a day.
Right.
So they used to do 3-hour shifts, except the mornings. Morning was 6 to 10, and then everybody else had 3-hour shifts. So in the average day, there'd be 7 different announcers in this little small room.
Right.
Right.
You know, and no windows. It's all boarded up. It's all soundproof. So if somebody went in there with a cold, guess what? You know,
Everyone had it.
we're just waiting. Oh, here comes somebody. You know,
Yep.
and so I would tell them, if you get sick or you get a cold, don't even come in the building. You know, because it would go through the whole building.
Sure would.
You know, and it's just the way it is. But again, I think the thing that, you know, so many people, you know, are afraid of it for whatever reason, and how important it is to have for good medical health for the course of a year.
Yes.
You know, and that's as simple as that. Now, you folks see people all the time. Do you strongly recommend, with your patients?
Absolutely. We recommend it to everyone where there's not a contraindication to it. Because to your point, the benefit is so significant and the relative risk is minuscule.
Right. Well, now you mentioned something 6 months and up. For a while, they weren't doing kids.
Right.
Back some years. So now they've expanded all the way down to 6 months.
To 6 months, yes, exactly. Right.
And when you think about it, imagine some poor little 1 or 2 year old getting that sick.
Right.
It's awful.
And they can't handle it.
Right.
Absolutely.
Right.
It's so vital. But that's the way it is, and so it's very, very, very important, and tremendously important that folks get their flu shots. So what other things can you talk about?
Well, I think to the point you made on the very young and certain populations, the CDC has a lot of good information in terms of statistics about the benefits of getting the flu shot. And actually there was one 2014 study that looked at pediatric ICU admissions, and that study actually showed, I think, a statistic here where there was a 57 decrease percent of pediatric ICU admissions for flu versus those that had not been vaccinated. So to your point, for the those with advanced years, and notably those that are very young, it really has a huge impact on admissions. And in the U.S. every year, there's tens of thousands of deaths from the flu still. People don't think about that aspect of it, but it sets off a horrible chain. When you're in the ICU, you pick up other life-threatening issues, and it's a horrible spiral that can occur. So we really recommend it to every patient that we see, with very few exceptions. And
do you have people who just say no?
Absolutely,
Yes.
Every day, and it baffles us. It really does.
And I mean, what do you say to them? You say, why?
A lot of times we ask, like, the contraindications. If there's something that's seriously wrong with them, obviously it's going to be in their problem list in their chart, but there could be things that they're going to see if they're a new patient and we don't know that much about them yet. If they have something going on, then obviously we're hope to know, why wouldn't you want it? And if you're healthy, get it. You don't know who you're giving it to. You could walk up to somebody that unfortunately has cancer and you're carrying the flu, and they get sick and end up in the hospital.
And it doesn't. It starts funny. It doesn't just go boom. I got the flu. It sort of builds up in you, and then all of a sudden And you mentioned something about young people. I mean, think of the ramifications of a kid who's in school, and you can go kindergarten, first grade. You pick the grade. Kindergarten, first, second, right up to 12th. Okay, they're in the course of a day. They come in contact with anywhere from 200 to 400 other kids. They're in classroom settings. They're in the gym together. They're whatever. And if they're changing classes, they may expose themselves to, another 100 kids. And what that could do to a school system.
Absolutely.
And it's, and it's hard for me. I have to be candid. It is just because I'm so convinced that if you just do what the doctor tells you to do, you're going to be okay. I know I had a funny story I shared with you earlier about Dr. Gorel and the AA program that we did, and it was funny. I was chatting with him about it, and he started to smile, and he said, "Look, Dick." Because I myself, I'm Irish, and I used to have 1 or 2 beers. And March 3rd of 2014, I decided that I wouldn't drink anymore. I decided to drink. I said, it's only 1 or 2 beers, and I used to drink Select 55, which is 2.5% alcohol. A lot of people like wine. People don't realize wine's 13% alcohol. 2 or 3 wines and you're hoopy.
Yes.
I mean, I used to be commissioner. I used to be commissioner of highway safety, and in fact, I wrote the first seatbelt safety law in Massachusetts, and I wrote the first drunk driving law, in way back when Governor Volpe was governor, back in the '60s, and the first drunk driving law we had in Massachusetts was a .10. Now it's down to 0.8, but it was 1.0, and we had the governor there, and we had a state trooper come in. And we had the old breathalyzers, and he sat and had a beer. Then he had a second beer, and we keep doing it to show the governor how fast you whoop
Yep.
You hit a 0.1, you know, or a 1 point, but the thing is that it's just unbelievable, you know, and people just don't understand, you know. So the point is, I just decided, I said 1 or 2 beers, and I was telling Dr. Gorel, it was March of 2014, so it's almost 3.5, a little more than 3.5 years, and I was telling Dr. Gorel, I said, you know, I got to tell you, Alan, on top of that, I feel better. I feel a lot better. And he started to laugh. And he says, Dick, I know you well enough to tell you this. If alcohol was really any good for you, one of the pharmaceutical companies would be making a little alcohol pill. They'd be charging $200 for it. And every doctor in America would be prescribing them. He said, now, since that doesn't exist, guess what?
Right.
That's why you feel better, you know. But I mean, the point is, you know, we don't think sometimes. And getting back to our flu shots, it is so important to protect your own health.
Right.
You know, it's so important to protect your own health. You know, I know we get off the subject, but I loved January and February when I'm driving along in my automobile and I see 3 or 4 people outside the office door shivering with a cigarette. You know? And when I was a kid I used to be in radio, and when I was a kid growing up, I was a disc jockey at a station in the Boston area. And there was a guy named Phil Harris, was an old entertainer. In fact, you can go online and you can play the song. It's online. And the name of the song was Smoke, Smoke, Smoke That Cigarette. Smoke, smoke, smoke until you smoke yourself to death. You'll meet St. Peter at the Golden Gate, so don't you make him wait. And I sing that to people when I see them, you know.
That's funny.
Now, I'm one of these obnoxious people because I've never smoked.
Right.
Now, my mom and dad, my mother smoked Lucky Strikes and my dad smoked Camels.
Right.
You know, and I'm always amused by the people who say, I smoke, my father smoked and he didn't, he was okay. That doesn't make it right, you know.
It's true.
But it's the things we do to ourselves. And getting back to the flu shot, it's the same thing. A simple process, you know, takes 2 seconds.
Literally 2 seconds.
And you've got yourself protected, you know, and you'll stay out of trouble for the winter,
Right.
you know, and the trouble we have, and whether you believe in it or not, folks, and I don't want to get into the controversy of climate change. Winters are different. We can go from a 40-degree day to a 90-degree day. And if you think I'm kidding you, look at the last 3 weeks.
Right.
You know, where we've been whoop, whoop, and the same in the winter. You go out and it can be 24 degrees, and 3 days later it's 60.
Right.
You know, and that has an effect.
Right.
You know, and it's so. What do we have to do to get them to get flu shots? You know.
Exactly. I think people don't really realize how effective they can be also. Certainly the match of the flu vaccine for any respective year differs because they try to match it to the flu circulating. But regardless, if you look historically, they're 50, 60, 65% effective at preventing flu. So it's a very effective process that we have now. With, to our point, a very minimal downside. It's a 30-second inconvenience.
Yeah.
You may be a little sore in your arm for 1 day,
Right.
and you're protected. So
You know,
yeah.
it's fun. I used to pitch. I used to play back when I was a young guy, and you play with pain.
Right.
You know, you play with pain.
Right.
Right.
Your body's your body.
Right.
You know, you get up and you pay. You know, the older you get, you know, you get creaky knees. So what's a little pain? I mean,
Right.
you know, and even if you got it, it's minimal. It
Right.
is just, if the worst it can be is a little red spot.
Right.
You know, and right around the area can be a little tight.
Right.
Right.
You know,
Right.
for maybe a day.
Right.
Exactly.
You know,
Yeah.
it doesn't affect you. It's not going to hurt you. You're going to move your arm. It's not going. You know, you don't need a sling.
Right.
You're all set.
Right.
You know, and so, but the reward of getting it, to your point, Alan, is which is 65, 70% successful.
On some years,
You know,
yes.
a great successful rate.
Right.
You know,
Yeah.
I mean, can you imagine a baseball manager that could get a player that could get a hit 6 out of every 10 times?
Right.
Be amazing.
Exactly. So,
You know, I mean, the last guy that did that, he was Ted Williams. He had 406. That's 4 out of 10 times.
Right.
So we're talking 6.5 out of 10 times.
Right.
Absolutely.
You know,
Right.
and so when you think about it, the odds of success are in your favor.
right. Yep.
You're going to be protected for the entire season.
Yep.
You're going to be knowing that you have protected yourself. You know, and it's just that simple.
Right.
You know, it's so valuable.
Right. I think it's misconceptions that really keep people from doing it ultimately, though. A lot of people,
agree.
we hear this every day, that I got the flu shot 1 or 2 years ago, I should still be protected by getting that flu shot. And they really don't take into consideration every year the flu shot is tailored to what the flu is
strains,
circulating.
yeah.
Exactly, the strains that we're seeing that year. So there's really very minimal benefit from year to year. You have to do it every year
Well,
consistently.
there's one other factor too, Alan. Tell me how many things you know that last forever.
Right.
So you got it 3 years ago.
Right.
How many things do you know, including us?
Right.
How many things do you know that last forever?
Right.
Right.
Okay.
Right.
Yeah.
Nothing that I know of. You know.
Right.
You know, and I can't think of there's nothing. There's nothing I know that lasts forever.
Right.
You know, you build a beautiful building. Eventually, it has to be torn down, and you put a new one in there.
Right.
Right.
You know, I mean, look at we got schools that were built in the 1800s. They're all gone.
Right.
You know, they
Right.
put there's a new one there now, or there's a new one up the street from it, because nothing is forever. So
Right.
even if you got it, there's no medication that lasts forever.
Right.
You know, that's why they give you more than one pill in a bottle.
Right.
Right. Right.
Yep, you're going to need it every day.
You know.
And most people think that, you know, like the theories we were talking about, that if you get the flu shot, you're going to get the flu. More than likely, if you come down sick after you've gotten the flu shot, it's because your body was already making something happen before the flu shot. And it just so happened it was a coincidence you got it at the same time.
Yeah, I mean, but the chances of that are nil.
Yes.
Right.
You know, I mean, if you go back to Alan's point that it's 65% successful.
Yeah.
You know, hello.
Right.
What about that's troubling?
Right.
You know, what about that's troubling? And it's just a simple process. And Jennifer, what do you want to do? My left arm?
Whatever is comfortable
Well,
for
it
you,
doesn't
I will
matter.
do.
Well, they usually ask me the first question: what arm do you write with?
That is true, because a lot of times if it's sore, it can affect your writing hand. But like you said, it's only sore for a day.
I can't believe I don't have a little permanent hole, because I get one every year.
Right.
And you know, we got
Skin's an amazing thing to
yeah.
heal.
Right.
Oh yeah, gone. You know.
It's an amazing thing to heal.
But the thing is that it's we're gonna do it, folks. I'm gonna get a flu shot because I want you to watch it and see how simple this really is, and see what we do, and know that all you have to do. There's a sign at every pharmacy you drive by. Get your flu shot today. You know, go in and get one.
Right.
You know,
Right.
and I saw one the other day. Oh, I know what it was. The Charlton's, and I want to mention it. The Charlton Senior Center is having a flu shot thing, and it tells you know bring your little insurance card, and then it says this: even if you don't have insurance, no problem. Come and get your flu shot.
That's great.
Okay, and it's right on. It was right on the little brochure they had for the senior center in Charlton, and they're having a clinic. A week or two ahead, sometime in middle of October, I believe it is. I saw it. I saw the sign somewhere, and so there's no reason not to get it.
Right.
You know.
Right.
I think the other piece too is some people will say that they've had the flu in the past. It's never really hit them too hard. So they see it just as a mild inconvenience. But what they don't realize is year to year, it strains very wildly. And some years the flu isn't too bad. Other years it can be very incapacitating for people, and the hospitalization rates and accordingly be much higher too. So you're playing Russian roulette by going off a past experience of maybe being lucky with the
That's
flu.
like saying I was run over by a car and it didn't really hurt me. So,
Exactly.
so I'm going to go try it again.
Right. Right.
You know, okay.
Right.
You know, it's amazing, and I chuckle, and I don't really mean to, folks. But when you really think about it, the excuses we give, and the rationalizations, I guess is the word.
Right.
You know, gee, I had the flu and it wasn't that bad.
Right.
You know, really. You know.
I think there's one other point we should make also is people feel that they can get the flu shot and they're just protected. There's really benefit to getting it early in the season when you say that they're being offered. Take advantage of that, because it can take the body 1 to 2 weeks to develop the antibodies to give you the protection that the flu shot offers.
Yeah, that's another thing we should mention too. Just because you get it doesn't mean boom, you're all set.
Right.
There's a period where it's got to get into your system, and there's a week to 2 weeks before it really builds up into your system to protect you.
Right.
So the sooner you get it, the better.
Right. Exactly.
It's like the people are all amazed about and it's a tragedy. It's sad. Don't get me wrong. The hurricanes that we have sweeping across. The guy was on in August and said it's going to be a big hurricane year. Did you think he was kidding?
Yeah, exactly.
Now you know.
Right.
They're stacked right up coming over.
Yeah.
And yet, in August, the National Weather Service said it's going to be at least 14 this year.
Right.
And
Terrible.
here we go.
Yeah.
Right.
So.
Yeah, on top of everything else.
Yeah. So.
I think as we get ready for the flu shot too, I
Yep.
think one other point we should discuss is certain populations. We've mentioned the very young,
Yeah.
also the very old, that there's many other groups that it's especially critical for them to get the shot. The diabetics, anyone with chronic renal or liver issues, those with asthma, COPD, all these populations, you're at such a higher risk to have a very negative outcome from the flu and hence the hospital.
Well, like I say, if I have to be real careful, because if I get a cold,
Right.
I got to watch it because I can be in bronchitis like this.
Right.
Right.
So I watch it, like a hawk.
Yep. And people that are prone to pneumonia, a lot of
Absolutely.
people will say, "Oh, I've got the pneumonia vaccine." Okay, but the flu can cause pneumonia. So
Yeah.
even if you have the pneumonia vaccine, you still get the flu.
Yeah,
Right.
still get the flu. Let's
Yeah.
go.
All right. Let me get it set up for you, sir. And
Okay.
I'll be happy to do it.
So you can watch this now, folks. This is real simple. Look at that little kit all prepared.
All prepared. Our nurse, Nicole, she got it all set for us, so. Whoop. Everybody gets nervous about the size of the needles. They're really not that big, guys.
Right.
No, they're not.
Yeah. Another point to keep in mind too, these are inactivated vaccines. Any vaccine you're injecting into your body, either it's recombinant DNA or it's inactivated virus. And in neither case is it a live virus. And I think a lot of people are concerned hearing that I'm getting the flu injected into me. They're not.
They're not.
You're
No,
not.
no, it's not. It's a preventive.
Right.
Plain and simple, it's a preventive. I mean, when you think about it, I mean, my dad used to say, whatever happened to common sense?
Right.
Why do you think the medical community would give you the flu?
Right. What's the benefit of that?
Yeah, what would be the purpose?
Right.
So you got to think of that too.
Absolutely. And they're so readily available. Workplaces, local
Oh, yeah.
stores, our offices.
Yeah, it's everywhere. I mean,
Right.
all the Harrington, there's Charlton, there's your practice,
Right.
there's the main hospital, there's Webster, there's, now they're in Oxford.
Right. There's no excuse.
So you can go and get them.
They're everywhere.
Yep.
And if you live at Overlook, they give them to you there too.
Really?
Yes.
And you have the best MA here giving you your flu shot.
Oh, I'm sure I do. Listen, that's what I told Blaine. I want the best you got.
All right, so normally when we give them, we would give them 2 finger lengths down, but your shirt doesn't go up that high, so where we give it is absolutely fine. Pinch the skin real quick. 1, 2, 3, done.
2 seconds.
Done.
Done. Whoop, I'm dropping your Band-Aid.
I don't think you're suffering too badly either.
No, I'm not. And guess what, folks? I'm now protected.
Right.
And that's the important thing. The process has begun. It may take a week or 2 for me, but it doesn't matter. I've protected myself. Thank you very much.
You're welcome,
Jennifer,
sir.
that was great. And the thing is, folks, it's so important, and I'm so glad that Jennifer and Alan were able to come today. And in Harrington, we're so fortunate to have a healthcare facility. I mean, you go back maybe 10 years, it was a Harrington hospital.
Right.
And now the footprint has grown, and they've reestablished themselves, and they provide. I mean, there's the urgent care unit. There's one in Oxford now, and there's one in Charlton, and then there's Harrington at Hubbard, and they've got offices in Spencer, and in Brimfield and so forth, and they've really gone out of their way to provide great health care service to the entire community, and we're so fortunate to have that. And again, my thanks to you, Jennifer, and to you, Alan, for coming by. It's terrific. And folks, I can't stress it enough. You saw it. It's done. It's over with. Dickie Boy is covered for the winter, and believe me, it was a great process. You saw it. It took seconds, and get yourself a flu shot. And there's no excuse and no reason that you can give not to get one. So guys, thanks a bunch.
Thanks for having us.
And I really, really appreciate it. And I hope folks get the message that it's so vital important to get yourself a flu shot. Thanks a bunch.
Absolutely.
you.
Thank you.
And there you are, folks. That's another Conversations with. Get your flu shot.